morning to the Frontline Responders Network. My name is Dan Malloy. I am a founder of QRT National and a partner of the C4 Recovery Solutions Organization. We have gathered together this morning, Friday, September 25th, to discuss, the resources that are available, to talk more about mental health resources from the state of Ohio, as well within the region of Wood County. And from Wood County, we have Mr. Chris with us, and he's going to introduce today's event, and then we'll get into the meat of our session. So good morning, Chris. Thank you for joining us.
Well, thank you for having me. And thank you for everyone that's attending. This is kind of the first day of a wrap up of the week of appreciation, kind of reaching out to first responders and just really thanking you guys in a very small way for everything that you do. But I did want to talk just briefly about Wood County resources that are available, and I'm going to start with the first team. So that's our first responder support team. It is peer supports that's available to all of our first responders in Wood County. You can find that at woodcountyfirst.org. If you have any difficulty, you can contact anyone from your department, whether that's fire or police or our hospital system. You should have contacts that are available and flyers that are out there. But if you can't find it, give us a call at the board and I'll help direct you to wherever you need to go. But we want to make sure that you feel supported in every way that we can. If you'd prefer to go for like a professional, we also understand that many of our first responders, they don't want to go to the same agencies that they're taking the public to. They don't want to run into that person that they that they picked up last night or they served last week or that kind of thing, and we certainly understand that. So one of the things that we've been able to do is work with the State Department and train some private clinicians. I think we have a list of about 20 private clinicians that have been specifically trained to work with first responders. We want to make sure that they have all of the skills that they need to understand, kind of what first responders are going through and how to best serve them. So if you need, any of those, please give us a call at the Wood County Adams Board. We'll help direct you to where you need to go. We also have a warm line for first responders, specifically during COVID, because we know during the pandemic, there are just more and strange stressors that we didn't anticipate. So we have that as well. But the bottom line is, if you need anything, give us a call, and we're going to do what we can to make sure that that's available to you.
Thanks, Chris. That's the value of that information, and we've had a chance to look at the website, and we're very impressed with the Wood County First site. That's awesome. Again, looking at thinking ahead and making it available for first responders, and it's something that as a career first responder, everyone on this panel has spent more than 30 years in the service, and it's just the realization that we appreciate that you think about us. That you take a moment to say, we need to think about these folks and maybe take care of them, give them those guys the resources. So thank you, Chris, for having us. We've got the panel's not big, but we have a ton of experience, and we're excited to be here with you on Friday. We're with you on Monday. You'll recognize Chief Khan again, as well as myself, but then you also know that you spent time with us on Wednesday, and Dr. Bob and Rick. Those folks were fantastic in that national discussion. Well, today, again, as we said earlier, we want to focus on Ohio. We want to focus on the Northwest Ohio region and what peer support looks like and resources look like for the bigger picture. So with us today is Battalion Chief Steve Kahn from Colerain Township Fire and EMS, as well as retired Highway Patrol Lieutenant, State of Ohio Highway Patrol Lieutenant Stephen Click, who now is the first responder liaison for Ohio Mental Health and Addiction Services. So welcome you both with us today. Steve Click, if you wouldn't mind just introducing yourself to the group, and we're excited to have you with us today.
Great, thank you, Dan, and I want to thank everybody for being here with us this morning. And I really want to take just a minute to thank the boards. This First Responder Appreciation Week is such a great idea. And if there was ever a time, it's always been great, but if there was ever a time that it's so important to take a moment to thank our first responder community, police, fire, EMS, corrections, dispatch, frontline medical. It's been certainly in 2020. And especially for our law enforcement partners, you know, the events since we've been dealing with since May. So I know that the boards across the state have done a great job. Awakaba has done an outstanding job pushing out the promotion as far as thanking and recognizing the work that our first responders have done. As Dan said, I'm a retired lieutenant from the Ohio State Highway Patrol. I now serve as the first responder liaison to Ohio Mental Health and Addiction Services. It is an absolutely wonderful position that I have. I get to work with Ohio's 100,000 plus first responders, which is police, fire, EMS, corrections, and dispatch. We've actually done a little bit of work with some of our Ohio-based military, even our Ohio Air Guard and our Ohio Army Guard. And you know, the idea is that we want to provide all the possible resources we can. That is the reason that OMAS created this position, is because they recognized and appreciated the work that first responders are doing, and they wanted to get somebody that could come in and kind of comes from that community. And I really appreciate OMAS giving me this chance to be part of this. A couple of things that we offer, Danny, is first of all, I'd like to talk real quick about the Ohio Assist Post-Critical Incident Seminars. Ohio Assist PCIS, the Post-Critical Incident Seminars, is a partnership between the Ohio State Highway Patrol and the Ohio Mental Health and Addiction Services. It is administered by the patrol as part of the Office of Personnel. And these are a series of 3-day seminars that they hold here in the state of Ohio that are open to any first responder and a support person. A support person is a spouse, a boyfriend, girlfriend, coworker, just somebody they want to bring with them. These seminars are held here in the Columbus area at a local hotel. There's no cost to the agency, and there's no cost to the first responder or their support person to come to the event. They take care of the lodging, they take care of the food. The event is 3 days. It is absolutely amazing. This program started in the year 2000 back in South Carolina. They've been doing it since then. It's now, I believe, in 11 states. Ohio has had it since March of 2017. We've had 9 post-critical incident seminars to date. We had to reschedule 2 from this year. We have one coming up at the end of October, and again, another one coming up, we hope, at the end of November, if we can get the scheduling all worked out. Obviously had to postpone a couple because of COVID, but it allows first responders and that support person to come in and talk about their event or events. And it's not a debrief. It is not a critique or an operational overview. It is a chance for that first responder to talk about what that event or events, how that has affected them and their families today. And what we know is first responders tend to really, really edit what we tell our families. What I can guarantee you with absolute certainty is that our families edit what they tell us. And the post-critical incident seminar gives that first responder and that support person a chance to have a very open conversation. Sometimes for the first time, that spouse hears exactly what happened to that first responder. And I guarantee that's the first time the first responder has heard what the family went through as going through that event or events with them. We break into small groups. We give them an opportunity to meet with a clinician for a one-on-one conversation of whatever they want to talk about. We offer chair massage. We have an open AA meeting for those people who are either in recovery, thinking about, maybe they should be in recovery, or they have a friend that should, that they're concerned about. We offer an open non-denominational prayer service, but everybody gets a chance to talk about it. We have classes or presentations on relationships. We have presentations on addiction. We actually have a wonderful presentation by the division chaplain. Reverend Ellsworth is 95 years young. This past July, just yesterday, was inducted into the Ohio Veterans Hall of Fame. The man is absolutely amazing. But he talks about the ministry of presence, the importance of being there. And for you folks, sometimes it's not about what you say. It's just about being there. In addition to that, through the first responder liaison position at OMAS, we offer a couple of trainings. One is called crisis awareness, and that is just to normalize the reactions that first responders may have to a specific critical incident or a career's worth of critical incidents. And we talk about bears and ducks, and some people use the backpack analogy, but we talk about the fact that you don't have to have that one event for a career in public safety, police, fire, or any one of those, for it to affect you and your family. So we talk about that. We also talk about addiction. If an agency wants us to talk about that, we do offer that as well. We offer another class called self-care. And it's just 2 hours on why it's important for first responders to take care of first responders. You know, you're so busy taking care of your communities, your families, your friends, your agency, that very often at the end of the day, you haven't allocated any time for you. And so this is not one of those things that I'm going to, you know, we talk about anything that you've never heard of before. It's just a reminder, a good reminder for first responders, and especially for the mental health community, those people that are providing those services in the community. I had a guy ask me yesterday how I was doing. And I thought that was really kind of cool. He says, you know, we can't forget to take care of those that are taking care of others. And that's what the 2-hour self-care block is about, is reminding you to take care of yourself. We give some ideas and some techniques and so forth. I have another course called After the Call. After the Call is what does an agency do when they lose somebody to line of duty, accident, or suicide. You know, in the state of Ohio, in the past couple of weeks, we had 2 active duty law enforcement suicides and a retiree suicide just within 3 weeks. And we know that's an issue within the first responder community. We're working with the Ohio Suicide Prevention Foundation on the statewide suicide prevention plan, which specifically identifies first responders as an at-risk group. So we're working with those folks, and they're very responsive to trying to help the first responder community. But we know those things can happen to any agency at any time, that we could lose somebody to one of those things. And this program doesn't tell you what to do. It just gives you an idea to go back and talk as a command staff and make a decision for your agency. This is what we're going to do as we move forward. So when that bad thing happens and you're in the middle of all that chaos and you're middle of all that emotion, you just pull down the book or the policy and you bring it up and we just start going through it. And it answers some of the questions that, you know, we want to make sure that we're answering well, and we want to make sure that we're taking care of our people. Let's have that conversation when everything's nice and quiet, and we can have those thoughtful conversations and make a decision as an agency. The last program that we offer is QPR, Question, Persuade, and Refer. QPR is a national evidence-based suicide awareness, education, and prevention program. There is a specific module for public safety, which I use, but it's open. I mean, they have a number of modules for different target audiences, and it's an excellent course on how do we address that issue and how do we ask that question. And based on the answer we get, what do we do with that from that point on? Because we don't want to ask that question, and if the person says, yes, I'm in crisis, yes, I'm struggling, I'm thinking about it, we don't want to have, we want to have something beyond, oh, well, good luck with that. So we want to have that follow-up. There are a number of programs around the state of Ohio that are available for first responders. The Ohio Critical Incident Response Service has 33 teams. The Ohio Association of Professional Firefighters have 5 regional teams. As the gentleman was talking before, we've got teams all over the state of Ohio that are doing amazing work daily. And they don't care whether you're a police officer, a firefighter, a medic, a dispatch, they don't care. I was talking to a gentleman this morning from a department here in Central Ohio, and he says, all we care about is helping people. And I think that that's just the hallmark of all of these peer support groups, is they just want to help folks. And who you work for and what color your uniform is and whether you carry an axe or a pistol or you sit desk, they don't care. All they care is that we get you the help and the resources that you need. So those folks are out there. We can connect you with them. Dan can connect you with them. Chief Khan can connect you. All of those folks are just a phone call or an email away. That's one of my jobs as the first responder liaison, is to make those connections and build those bridges between the first responder community and those resources. And the last thing I kind of want to talk about just very briefly before I turn it over to Chief Khan is the fact that your boards across the state of Ohio, your addiction mental health boards, your mental health recovery boards, are such an amazing resource for us in public safety. You know, I was trained as a law enforcement officer. I was trained to make traffic stops, handle motor vehicle crashes, deal with resisting arrest, civil disturbance, and so forth. I wasn't trained to deal with folks in mental health crisis. Chief Khan was trained to deal with hazardous materials situation and house fires and motor vehicle accidents and rescues and all the things that the fire service does amazing. But again, that's kind of outside our normal areas of training. Taking advantage of the expertise and education and knowledge of the boards, having that personal contact with that board. So when I need them, I'm not calling a stranger. I'm not calling just some number. I'm calling a specific person, and they know me. And when they come to the department, my people have seen them before and they know who they are. And they're going to be more comfortable talking to them. And whether it's helping a member of my community, helping a member of my department, or helping a family member, making those bridges with your local mental health boards, absolutely imperative in order for us to be doing our job the very best we can. And especially as we move forward through COVID, through some of the things that we've seen, and we can anticipate that, things are going to continue to be a little bit chaotic, and anything that we can do to protect our staff, protect our communities, and protect ourselves is vitally important. So Dan, I want to thank you folks, and thank the First Responder Network for giving me this opportunity. This is a great partnership. I really appreciate this opportunity. Chief Khan, I'm all done, sir. It's all yours.
Anything else, Steve? Just real quick, my name is Steve Khan. I'm a battalion chief in Coleraine Township, Ohio, just outside of Cincinnati. Been on the job part-time and full-time for 35 years. Paramedic. I also am an RN. I've got 27 years as a registered nurse, as a critical care registered nurse. And so one of the things that I absolutely love about what's going on here today is this idea of a Frontline Responders Network that is, we think of the first line responders, the first responders, the police, the fire, and EMS, but what about the hospital? What about the stuff that goes on inside the hospital, especially in this pandemic, this time of unprecedented anguish and despair with a pandemic that we don't know how to stop. And when I listened to Steve talk, I thought, wow. The main takeaway I take from what Steve was just saying was that there's hope. If you think about the different programs that Steve just talked about at the state level, at the county level, I think this is being duplicated all over the state, where we have some regional teams that are up and running, and we know we have an entire resource at the state level that is not going to leave us behind. They're thinking of us. They're creating programs for us. I know people that have gone through the Ohio Assist program up there, the 3-day program that Steve first talked about. I know people that have gone through it as attendees and as clinicians that have assisted up there. And it is absolutely incredible, the things that our family members can bring to the table and what they take away. I'd like to say the main overriding thing here is that there's hope. 35 years ago, we never would have had any kind of a conversation like what we're having today. It would have been, suck it up, buttercup, this is part of the job. If you can't do it, get out of it. And if we use that same mentality today, we would be turning away great firefighters, great police, great doctors, nurses. Nobody's immune to this stuff. We have to pay attention to our needs. Like Steve was saying about the self-care, we need to be able to pay attention to our co-workers, our brothers and sisters on the line with us. And I think this is just a neat opportunity. And the fact that, the county, Wood County is doing this for an appreciation for all of us. I can't thank you enough for doing this. And hopefully this type of conversation is going to be duplicated among all, is it 88 counties, I think, or maybe it's I'm a horrible Ohioan. I don't even know how many counties we have. But if you think about that, hopefully that this conversation is being duplicated all over the state.
Thanks, Chief. Thank you, LT. I appreciate it. And I would be remiss if I didn't make everyone aware that we have Ms. Nicole Jenkins. She's our moderator for today. So if anyone has any questions during the event for the Chiefs, please absolutely, reach out through the Q&A the function on today's meeting, and Nicole will get those to us so we can make sure we answer that. And I have questions. I have questions that I can hope that you guys can answer. I know you guys can answer. That's silly to say. I hope you can. But Chief, what I was listening when I heard Steve is, where have you been? I would have wished that I would have known the LT was around, or Omos was thinking about this, 10, 12, 14, 20 years ago. Because the reality is that cumulative effect of the work that we do, we often compartmentalize it. So the auto crash or the homicide or the suicide, or, on and on and on, that those things that affected us. And, and I was in a conversation the other day, and the realization that in that cumulative event for a lot of us was 9/11. That the reality that, we as first responders, functioned unbelievably. It was an unbelievable day for the men and women that served, to watch fellow firefighters and law enforcement, do the work that they were doing and just put themselves in harm's way to save lives. And it's, true definition of what our oath meant when we took it. So, there's just so much when you talk about that accumulation of effect. But just for the audience, my background is career law enforcement, Southwest Ohio. I served in Coleraine with the chief as a police officer back in the 80s, and then promoted through and became the chief of police. And then in 2013 was promoted to director of public safety, in which I had the opportunity to work very closely with our fire and EMS folks for the last almost 5 years of my career, and learn more about, what it is that those men and women do. I thought I knew after working so closely together with them, but I didn't. And I walked away with a tremendous amount of much more respect than I ever had, because I just took it for granted, the significance of their education and their commitment to service. And to a point, I always told my wife is, we're not moving, because this is the best, this is the best agency that I know of, and I don't want to be anywhere else as I get old, because I want them to be able to save my life when I need it. So those are just powerful things. And again, opening ourselves up to the realization that, we need to take care of these folks. We need to take care of each other. We need to be available, because, LT, this very familiar, when I went through the Ohio State Highway Patrol Academy, and, the first time before I got hurt and had to go back for another 8 weeks and spend a glorious 22 weeks in that facility, just loving every day of it. The realization is, we used to talk about things like, the high rates of divorce, the high rates of suicide, the high rates of alcoholism, all, the death within 5 years of retirement. And I hadn't even started my career yet. And it puts, and what resources were available, and how do you move forward with that? And to think that there is, a state-driven initiative where, career public safety folks are helping them understand what it is that we may need, and then frame it, is, to Steve's point, thank you. Thank you for stepping up and taking that on. And I have a couple questions, but before I do, so if I don't mind me asking, why was this something that fit within your lane? How, after 36 years with the patrol, how did you end up, caring enough to commit yourself in your next life to serving in this way?
Well, it's kind of funny, Danny, because back when I was still a trooper at Delaware, myself and another officer went through this program that had been encouraged for us to go through, and it was critical incident stress management. We were a couple of the only officers in there. The fire service has been light years ahead of law enforcement in the areas of peer support within their agency, taking care of themselves. But that's kind of the nature, as Chief would tell you, that's the kind of nature, they serve as a house, they serve as a piece of equipment, they work as a team, whereas law enforcement, even in the state of Ohio, tends to work a little bit more solo. We go to a situation and we spread to the four winds, as you know, Dan. So I got involved with peer support back in 1991, or I'm sorry, 1989, is going through that course. And, the patrol didn't have anything. And then as a part of the Northwest Central Ohio Stress Management Team, I was invited to go to New York City. We went the Sunday after Thanksgiving in 2001, went back again in April of 2002 to work with the peer support team in New York City Police Department. And I was at World Trade, and I was down in the hole, and I talked to firefighters at that fire station at the very base of the towers that had lost so many firefighters. And we talked to police officers and firefighters and those folks that were there. And when I came back, I was fortunate in that the Highway Patrol said, look, we've got to do something for our personnel, because like Chief said, 35 years ago, we didn't talk about this. You know, in fact, I remember being told specifically by a sergeant who was about 200 years old at the time, if it was a bad day, go home and have a drink. If it was a really bad day, have more than one. And if you can't sleep, keep drinking, you eventually will. Now, he didn't mean harm by that, because the generation before him had told him that. We're smarter now. And I shouldn't say that in that way. It's certainly not to disparage him, but we just know better. You know, one of the things that Colonel Paul Pride said when we first started looking at the seminars is we couldn't be faulted for what we didn't know was out there. Well, now we know it's out there. And for our agencies, for the people around the state of Ohio, to know that there's groups like the Frontline Responders Network, and there's the First Responders Bridge, and there's Ohio Assist, and there's these peer support agencies. Now we are responsible. Now we are responsible to provide these services to our personnel, because we know they're there, and we know those are best practices. And so, you know, what we did 35 years ago, we did the best we could. So I came back, and we were asked to put together a team. We brought in an amazing clinician from DC, Dr. Beverly Anderson. Dr. Anderson did our initial training, and we created a team, and I helped guide and oversee that team until my retirement in 2018 from the division. That team is still going strong. They're doing great work, and they're not, again, a good example of they're not just for the Highway Patrol. They've been utilized for a number of agencies, where agencies have called, or even peer support teams have called and said, hey, this is so big, can you provide a little bit of help? And they don't blink an eye. One of my best stories was while I was still on the patrol is I had done a presentation, and a local sheriff had kind of given me a little rough way to go during a chief's meeting. And then we ended up getting a phone call. A tragedy had happened in his community, and one of his personnel, the daughter was babysitting a small child. That child got out of the house, got into a swimming pool, and died. And it was just a momentary, just, you know how kids are, you just lost sight for just a second. And he called and said, what can we do? And I sent somebody to the department, one of the best that the Highway Patrol's MAT has. And he called me a couple of days later. He said, you know, I never expected to see that uniform sitting in talking to one of my personnel. I'm like, Sheriff, that's the way it always should have been. I mean, absolutely the way it always should have been. I know early in my career, many times I was taken under the wing of folks that had a different uniform than I did. Even some firefighters pulled me aside to make sure that I was okay. So that's kind of how I got involved in it. And then in 2016, I was at the training academy. And when the Highway Patrol decided we were going to do the post-critical incident seminars and everything else, I was so fortunate in that Colonel Pride pulled me out of the academy and put me into looking at that. That program has been taken over and ran absolutely great by Staff Lieutenant Marty Falora, Lieutenant Molly Harris. They haven't missed a beat. They're still providing that peer support, still providing those seminars, working very hard to make sure that they're supporting all of Ohio's first responders. So it's been a team effort. Thanks to folks like Chief Kahn, Chief Jack Rupp from Plain Township. I've been taken under the wing by a lot of firefighters who have educated an old gunslinger on what it is to be a firefighter, and the sacrifices they make, and the needs that they have. And it's just been a great cooperative effort, and truly appreciative of all the help that I've gotten in this job. It's not one person. It is absolutely all 88 counties working together to help our folks.
Well, that just thanks, LT. I mean, that just, to Steve's point, again, using that same word again, that just gives you hope to realize that there's an opportunity for us to continue to grow and educate ourselves and understand the role that we play with each other, whether it's at the ground level or within administration or leadership. We have a role in making sure we're all healthy and safe and given the care that they need. Chief, if you don't mind, as I sit out here and I always wonder, okay, how do I mean, both cultures are not the easiest to look at one another and say, you know what, that hit me hard. I'm struggling with this, and then to feel like you can comfortably engage in that, and then look to each other and say, you know what, I'm sorry, I'm struggling to get over that, whatever that initial run was or that experience was. So, your experience in both the hospital network and within the fire and EMS service, is there is there a story? Is there something that can help those with us today to understand why is Chief Con care? Why is this important to him?
Well, Dan, as you know, because you went through it with me, basically, I took a little bit non-traditional path into this whole thing of mental health and taking care of our own. I've always been a servant leader. I've always felt like I needed to help prop up my people, give them the tools they needed to do whatever they wanted to do, to find success on the fire ground, in the firehouse, or within the fire service. In 2003, I made a structure fire call. Happened to be the same day as a line of duty death with Cincinnati Fire Department. We butt up against Cincinnati just to the north and west of it. We listened to the run come in, and my crew looks at me and says, hey, at the time, Lieutenant, hey, what are we going to do if this ever happens to us? We went out in the bay. We did some training for firefighter survival. We're never gonna need it, right? We always plan, but we never plan on expect to actually use the skills. That night we had a fire. As I was searching the house, we were over top of a basement fire. The floor opened up. I fell in, and I was trapped for 7 minutes. 7 minutes of sheer terror, panic. And I was able to self-rescue as they got the rescue teams and everything organized to come in and get me. But what happened afterwards was I had suffered, and I had been a victim of a serious critical incident, and there was no acknowledgement from some of my peers, maybe my administration. It was sort of like that old mentality of, wow, that really sucked, didn't it? Get back on the truck. I was back on the truck that night. I never went to the hospital despite landing on my head after falling 12 feet, in which I now have 3 vertebrae or discs in my neck that are a mess that I should have been checked out. But since there was really no acknowledgement, I had to internalize that and try and process through that myself. And it led me down a very, very dark alley. Did my peers care about me? Did my bosses care about me? Did the organization care about me? Then you start questioning, why the hell am I doing this? Am I doing this for the right reason? Am I in the right job? And it led me down an absolute pitch black path that to the point where I was suicidal. And I sought help. I got the help I needed with my wife assisting me through the entire way. And that was in 2005 when I finally reached out and got some help, but that just got me out of the crisis. That just got me up to where I was functioning again. And then about for the next 10 years, I was just here. And it wasn't until one of my good friends, a fire chief now down in Virginia, said, hey, you need to tell your story. And I started telling my story. And you wouldn't believe how cathartic it was to tell my story and then have people come up and say, that exact thing happened to me. My department did ABC, or the neighboring department, or whatever it was. And I had police officers, I had dispatchers, I had nurses and doctors that were coming up and basically saying, change the name, and that's what happened to me. And showing that kind of vulnerability, I think, you talk about servant leadership. Now I've got people that are, I'm helping people on a whole nother level, to the point where I'm part of our peer support, our regional peer support program, because they've listened to me talk and we've gotten the word out that we're here for you. We are here for you no matter what badge you wear, career, part-time, volunteer, police. Our dispatch centers are overlooked. They never get any kind of feedback on the types of incidents that they're dispatching. They want that closure. So we've actually established relationships with our dispatch. And, that's how I'm involved in this. Just from the ground up is realizing that our brothers and sisters out there need some help, and just providing that ear. I'm not a counselor by any stretch of the imagination, but I know that we need clinicians, we need people out there that understand our special kind of stupid. Police, firefighters, we think differently. We have a different mentality about some stuff, and you need special clinicians that have been vetted. And I heard Chris say that they've got over 20 clinicians in Wood County that they have, it sounds to me like they've vetted, that understand our special way of thinking. We don't want to get a clinician that that gets us in there. You know, no, we're not laying on the couch telling our whole family life story or anything, but we don't need the clinicians to be enraptured in our story. We want them to be able to help us through. So because we do think differently, and to have those vetted clinicians is paramount to the success of a program, because what peer support's going to do is they're going to listen, they're going to normalize the feelings and the emotions that are going on, but then our job is to help steer to the right resource. It might be AA, it might be Gamblers Anonymous, but it might be a professional clinician that they may need medications or whatever, but that's not up for us to decide. We steer them in those directions. Our success that we're having here in Southwest Ohio, and I would just assume that it's being duplicated around the state, because it's such a big issue, and we don't go out looking for people to engage with. They're calling us. And our peer support program within the tri-state area here, and we also do Southeast Indiana and Northern Kentucky. Within the tri-state area here, our tri-state peer support team in just the past 2 years have made over 200 referrals to clinicians. That's referrals, and out of that we've had, and I don't know what the numbers are, we're not trying to gain any kind of status because of numbers, but we know of about 20 people that we've actually been able to get them inpatient help because they were in crisis. Now that's 20 people that are still on the job today because they were brave enough to reach out and to ask for help. And that goes for police, firefighter, we've had physicians, we've had nurses, respiratory, dispatchers. It runs the gamut of our frontline responders. I talked about the dispatchers, but I know we've got some hospital people here that will be listening. And I recently had a COVID death in my family, where my family member was going to die in the hospital without anybody at his side. I pulled some strings because I happened to work at the hospital. I put on some scrubs and I went and sat with him while he passed away. And the amount of courage that our nurses and doctors have in the face of this pandemic, in and out of these rooms, in this COVID wing, of having to gown up, to suit up, and they're watching their patients pass with no family there. I can't tell you how many of those nurses and doctors thanked me, and I was being a family. That's my family. That's what we do, right? And to think of the anguish that our healthcare providers are going through as they witness this, now is the time to pay attention to this. And I really, I can't thank again the Wood County enough, and the people that are paying attention to this and trying to get our frontline responders this type of a resource. And that's where we are. So
thank you, Chief. I mean, I know you share your story now, but every time I hear that, even though I was working alongside you in 2003 and have ever since, and it still gives me chills to hear you tell that story again. It just but it's important, I think, for folks to understand where you come. Why is this important to you? Why is this important to LT? Why is this important to us that we would step out on that ledge and engage in a whole different environment? Because the first thing that jumps in my mind is, how do we as first responders, how do we know you're there? And that's what the Wood County First site is awesome. But how do we advertise? How do we educate our first responders that the peer support is available, or the services are available from the LT's agency? How are we telling our story so they know that there's a number to call, or there's a reach out? How's that work for you guys?
Well, and Chief brought up a great point about the tri-state team. So of all those referrals that they've been able to make, and all those folks that they've been able to contact in those agencies, That's somebody now, when they know a friend is struggling, they now have something that they can say instead of, wow, that's too bad, let's go to the bar. Hey, I've got somebody I can connect you with. Well, will you talk to this person? Will you call them? If I have them call you, will you please answer the phone? We go and we talk to chiefs meetings. Again, right now we're all virtual. I hate virtual. I can't wait to get back out in person. But in the meantime, we're able to reach out. So I know myself, Chief, all of these agencies, all of these peer support programs around the state of Ohio, give them an opportunity to talk to your chiefs meetings, talk to your board. Put us up in front of people. We love to be able to tell the stories about the folks that we're able to help and the lives we're able to touch. So any opportunity to get that word out. OMAS has a website. There's a first responder tab on it. Again, a lot of folks don't know about it, so I try to talk about it. For everybody we can. Encouraging them to reach out to the boards and encouraging the boards to say if they get a call from a first responder. And that was one of the things that OMAS started to get, were calls from boards that say, hey, you got folks out in the field telling them to contact us. Well, when they contact us, now what? We don't really know their culture and everything else like that. And OMAS is like, we got a guy. Let's put you in touch with a guy and he can kind of tell you a little, give you some background and stuff like that. Having clinicians that get us, when Chief said that about, we are a strange group. We run into burning houses. We run towards things that say hazmat. We run towards people with weapons. We go into dark buildings that we know. There's something, somebody could do a doctoral thesis on the mindset of first responders. But having a clinician that gets that, understands that sometimes our language isn't what our mothers would like to hear us say, but it doesn't mean we've got anger issues. It's just kind of the way we talk. And recognizing, whether you call it bears and ducks, whether you call it rocks in the backpack, whatever you call that, recognizing that 5, 10, 15, 20 years, whether you think it's a bear or not, it added up. It added up. When Chief tells his story, I'm like you. I was aware of Chief's story. When you realize what he did, and they put him right back on the truck, and they did. He's physically okay, they thought, so let's just put him right back to work. It's going to be the best thing for him. That was our mindset for so long. Throw him back out there. And, these people don't get how much firefighters, medics, police officers, dispatch, correct. It's not a job. It's a mission. It's in the DNA. My brother is an accountant. He's a very successful accountant, and he does it very well. That's my brother's job. But it's not in his DNA. It's in Chief's DNA. Danny, it's in yours. Even once we retire from wearing a uniform, we still can't let it go. And I think having clinicians that get that and understand that that's us, that's just who we are, I think is so vitally important. And Chief would have never thought twice about, jumping back on that truck and getting right back to work. It never dawned on him not to. And all these firefighters, police officers, and everybody else, they don't want to not do this, but they want to do it healthy. They don't want to have relationship issues, and they don't want to have substance abuse issues, and they don't want to be depressed, and they want to be able to sleep, and they, all of the things they want, but at the same time, they still want to be out and be able to go out and serve their communities. They just want to do it healthy, and that's what their families want for them as well.
Well, we're kind of setting expectations, don't we? To Steve's story earlier, the expectation was the culture in the organization said you get back on the truck. And as a young, energized, enthusiastic, passionate, servant, you do it because that's what you do. And there's no one there to say, and that's where that's the change. That's the understanding, the education. If that happened today, Steve would look at that and say, we have systems in place. We have leadership that's not going to tell you that you're weak or you can't. Just like, this is what we do to make sure you can come back and last another 20 plus years. We want you to be healthy. We want you to be safe. And again, we didn't know what we didn't know, but the reality is we lost a lot of good people along the way because of that. And Steve, can that through OMOS, or is that like, can they connect 24 hours a day, 7 days a week? So whether it's 2 a.m. or Sunday night at 7 o'clock, is that a connection that can happen at any time, or is it a Monday through Friday, 8 to 5 kind of a thing?
Well, it's not Monday through Friday, 8 to 5. There is the crisis text line,
Okay.
and they can contact the crisis text line. The peer support teams are 24/7.
Okay.
They don't care when and where. That's Christmas Day. That's whenever. And those folks that do that very often, because I've been able to gain a lot of contacts with them, very often they are that amazing initial response, and they're continuing that ongoing care for that first responder. But then very often I wake up and check my email, usually before I even roll out of bed. And then I'm able to get up and start making phone calls. And if they say they need resources, and again, if somebody says, hey, I got a firefighter that's got this, hey, I got a battalion chief I can call. And I would immediately call to somebody like Chief Khan and say, hey, I've got this situation, the guys from another agency, whatever. So that, just as soon as I'm awake, that's usually available. But those peer support teams, absolutely. Those folks are 24/7, 365. They're there no matter what, when, and everything else. The state level resources, as I know about it, immediately jump on it, whether I'm in state or not. But the peer support teams, tri-state, all of those teams across the state of Ohio are absolutely amazing, and they're there anytime that they're needed.
Awesome. Thanks, LT.
Yeah. So,
Steve,
Dan,
how does it
what
work
we
in
did,
Southwest Ohio?
what we did in our region was, just like Steve said, we get the message out through our chiefs associations, our police, our fire chiefs. We have a pretty robust system here in Southwest Ohio for hazardous materials response, for county level hazardous materials, county level urban search and rescue, county level fire investigations unit. And so what we did, we sort of piggybacked on top of that. And we actually stole or hooked up with the critical incident stress management team from 1989 that Steve was talking about down in our area. And we have the ability to be dispatched as a peer support team through our county. Now, the first level is changing the organization or the culture so we can talk about it and do word of mouth back and forth. But if we have anything from an individual fire, police, first responder that wants to talk, they can dispatch us through Hamilton County Dispatch. All the way up to an organizational disaster, maybe a death of a firefighter, police officer, suicide of a member, line of duty death, or whatever, all the way up to an organizational or a regional disaster. We can be dispatched through the Hamilton County, and then our board will start assigning people and getting the right member, because police sometimes don't want to talk to a fireman. Firemen sometimes don't want to talk to a dispatch or whatever. We have members on our team from all different organizations, and we try and find them the right person for the fit. And like I started to mention about the culture, and Steve mentioned the fact that our police officer, a lot of times they're riding solo. That's a tough nut to crack. When you're out there by yourself in a vehicle and going into these stressful situations, and how do you de-stress after that by yourself when you're still out on the road? At least in the fire service, we have the ability to come back and meet around our dinner table. We have dinner time, we have lunch time, we all sit around together. Dispatch, you can't have all your dispatchers take off at once to go eat lunch. So our dispatch center had two chairs in their lunchroom. So they have 20 people on duty, but they can only eat 2 people at a time. They changed some of their things so they can start having some debriefings at the end of their shifts. How was your shift? How's your mom doing? I understand your mom was sick. Remember, we're all in this together. We are all a family. So it's really important to have those types of opportunities to sit around and talk about things as a crew, as your shift, that really have nothing to do with the shift. It may be about your kids and their sports they're playing. We got to change this culture, and we're on the way to doing it.
Well, we don't like to show weakness. We don't like to demonstrate it because, again, the organizational culture may not allow us to be human. You know, it may not allow us to say, you know what, I struggle with that, whatever. You're right. The culture is changing. These conversations and the creation of, you know, the peer support network and roles such as Steve carries with the state. I mean, that's just 2018. You know, and to think all the things that have occurred over time, you know, that we could have taken advantage of such an event. But the one thing that jumps out at me is, you know, as a first responder, you know, what about confidentiality? You know, what about if I call you and I share, is there an expectation of confidentiality? Is there anything relative to that? If you guys had that question, or how do you deal with that?
I know from our standpoint, we make that clear from the very get-go. When someone talks to us, one of the first things out of our mouth is, what you tell me, I'm not telling another soul. With the exception of possibility of self-harm, or, you know, something that's mandated by law that we have to report. But, you know, our people they have a right to expect that privacy. And that was one of the main reasons that the peer support, I know through the IAFF, was brought up, was, you know, for fear of repercussions and other things, that some things might be held against somebody or whatever. In our viewpoint, and I can't speak for everybody, but I think I do, that there is an expectation there of privacy. And if they can't trust us, then we have no business being there, and that just destroys the entire system. And we stress that upon every one of our peer supporters, and we tell that to our brothers and sisters from the moment they talk with us, that this is between us. Now, Steve will probably be able to tell you that as a police officer, there's a lot of other expectations with confidentiality and protection under the law. So do you have anything on that, Steve?
Well, and Dan, one of the things that we know is that, again, I'll use Chief Khan as an example, is the generation that believed that the department was entitled to everything, and if you don't tell me what, you know, Dan talked about, I'm going to fire both of you. And so that mindset is going away. If there's any of those dinosaurs left, they've got to be maxing out on being able to still be able to get the uniform on. But having that buy-in from the agency that does not go to the peer support and understands, and sometimes that's education. You know, I know for a fact that even with the patrol early on, we told them, look, we're not going to tell you what he or she said, and that's just the way it is. And a couple of times they needed to be reminded, and we never got pushback. They never threatened anybody, but they just needed to be reminded, because, you know, their question was well meant. Hey, Steve, how's Dan doing? And I would smile and say, I can't talk about that. And, you know, well, I just wanted to see how he was doing. Well, then pick up the phone and call Dan. And it took a couple of times of that before they realized, well, you know, Steve's not even going to tell me that he and Dan talked. And as Chief said, when these folks get trained in these peer support programs, confidentiality, I mean, we don't even talk amongst ourselves about what was said. I mean, it is between, you know, you and I, except for certain exemptions, but it is just between you and I. And even if I connect you with a clinician, or I connect you with somebody else, it's going to be, hey, I'd like to, you know, have this gentleman give you a call. They were involved in an on-duty situation. And then your story is your story to tell. It's not my story to ever tell anybody. Your story is your story. And you know, if I refer you to a clinician, they know how to bring that out. They know how to have that conversation. And I would never refer you to somebody that I had questioned was not going to protect your confidentiality or something like that. And even to the point, they won't even tell me that you two talked. And I needed to be reminded that early on. You know, I'd call and I'd say, hey, did you talk to Dan the other day? And they would just smile at me and say, I'm not having that conversation with you. And I'm like, oh, okay. So now I don't even ask anymore.
They'd say, Dan who?
Yeah, exactly.
Dan who?
I just assumed that it was taken care of. And, you know, I know that's a concern for folks, but I think that, you know, especially when talking to the clinicians, they need to understand that, you know, that there's a legal privilege when you're talking to a clinician. And that's one of the reasons why we make those referrals when we know that it is of a nature that they need that additional level of training, education, and expertise to assist them, we get them to those folks just as fast as we can.
Okay, I'm gonna put my hat on. I'm gonna put my chief hat on here for a minute and just kind of go through. Let's just say, you have, back in the early '90s, I remember, an OPATA-based training where an officer-involved shooting to have a cadre of of officers where you could assign Dan Malloy to Steve Click in the event that Steve was involved in an officer-involved shooting, and then Steve would have Dan, and it was built in that the confidentiality was there, that you could tell Dan anything. And that was just, of course, I worked for an agency at the time and a chief that said, absolutely not, we're not doing that. We're not doing that. So think forward and say, I have an officer involved shooting and I want to take care of that officer. Would I be better served if I had someone like Steve in my organization that was already understanding what the peer support network was about? And would I be better served utilizing my internal resource, or would I be better in the big picture calling someone from the outside? Based on your guys' experience, would I, that's cool, I've got someone already involved, or would I be better to bring in somebody completely different? Do you have an opinion on that?
I think it's case by case, and Chief, I don't know, I think it's really case by case. Sometimes folks really can talk to somebody within their own agency and they're comfortable with that. Other times there's a benefit. I've actually called folks from out of state because somebody's like, I'm not talking to anybody in Ohio. I'm like, you're up here, doesn't matter. I ain't talking to somebody in Ohio. Great, give me 10 minutes and I'll find somebody in South Carolina that can talk to you that you ain't never gonna see. So
the same thing, exact same thing.
Yeah, it's really case dependent, Danny.
I just, there's like, okay, do you really trust them to be quiet because who they are, or what
Yes.
they, you're right. Will they really keep it quiet within our organization if I share something that, might open me up to, some kind of criticism or something along, whatever goes through the mindset? I just wonder, because we had an officer involved shooting, and the first thing I did was connect them with another officer in our organization that had been involved, and basically assigned that officer to that family, and basically just said, you're here, you're there for them, you're working with them till they're ready to come back, and I want to make sure that they have somebody they can look at and say, what the hell just happened to me, and what am I doing? And I always wondered, was it right? But I didn't. I'll be honest with you, I wasn't aware of a greater group within our region that was available without making like official appointments and things of that nature. So this is just, again, I wish you would have known that there was an organization or people like you guys, 10, 15 years ago, because but we grow. And I think that demonstrates that we pay attention and we bring smart people together and we figure out how we can help each other, which is really, really awesome. I know that we only have a couple minutes to go before we end. I want to thank everyone for joining us today. And I know that this, if I'm correct, this has been recorded and will be available to a larger group outside of today's moment in time. So whether you work day shift or night shift or whatever, you can come back and learn what the LT went through and what he does through OMOS and his services available. And one question real quick to get on is, how do we apply for any of that training, Steve? How do we say, I'd like to attend the ASSIST program, and how's that screened, and how's that determine who can attend?
Well, just reach out. The way we vet and the way we pick it is what the partner states who have been doing this for 20 years told us. It's first come, first serve.
Okay.
Because I can't say, Chief Khan's incident warrants it or doesn't. And I would never want to do that, because that's Chief Khan's incident. So basically, we take them on a first come, first serve, and then we start build a waiting list. That kills us. That kills us, that we've got folks that want to come, but at the same time, we got to make sure that we're taking care of the 30 to 32 people that we've got. Any of the trainings that you've got, feel free to reach out to me, reach out to Dan, reach out to Nicole. They all have my contact information. We'll get it to you. If you've got something specific to peer support, please reach out to Chief Khan. Those folks down at Tri-State are doing amazing things. And we're always available. Just reach out to us. Again, through you folks, you've got a way to forward things to us, and we'll make sure that we get back to them right away.
Thanks, LT. Chief, any final parting words?
No, I just, again, thank you. I think that Wood County doing this is kind of like the cutting edge, you know, just you're not just having a small dinner time conversation. This is going out to the county and the region. So I think this is a great opportunity. I can't thank you guys enough for inviting us and inviting me to participate in this. Hopefully this is the beginning of a lot more conversations and a lot more a lot of more things to come. Thank you.
Thank you, guys. I great. And Chief, I thank you for spending time with us past your 24s and staying up with us. And
I'm going to go to bed.
Hey, go to bed. Go home and go to bed. And thank you all. Thank you all, and stay safe in Wood County. And Wood County First is the website. And stay safe and stay healthy. We thank you all for joining us this morning. Take care.